All right, thank you so much. I will present the mental health impact of depression, anxiety, and stress of COVID-19 among midwives in Ethiopia. 2001, it's a nationwide survey. And here is the presentation outline. It will have introduction, objectives, methodology, as well as the ethical consideration, and then the results and discussion, as well as the limitation, conclusion, and recommendation. And we'll have some preferences and acknowledgement. Here are team members of this research. Teams composed of University of Gondar as well as teams from Waldia University. All right, when it comes to the introduction part, coronavirus disease or COVID-19 is an infectious disease that is caused by a new strain of novel coronavirus, first confirmed in December 2019 in Wuhan, China. And this COVID-19 has rapidly crossed borders, infecting people throughout the whole world, as well as its emergence and spread caused confusion, anxiety, and fear among the general public, including those healthcare professionals. And because of their direct contact with the patients, healthcare workers are among the highest risk of group of populations to get exposed for infection and to just suffer psychological exhaustion after working in an extremely stressful environment within the pandemic. As well as the life-saving support those midwives provide presents a unique challenge and require close and prolonged contact with women and their newborns, which put them at higher risk of being exposed to acquire as well as to transmit the disease to other individuals. And during the eruption of this pandemic outbreak, many of the healthcare services were interrupted, and almost everything in the globe has been messed up due to this pandemic, and the healthcare services were partially closed. However, those military services were among the services continued as usual without any interruption. And furthermore, the limited availability of personal protective equipment has raised concerns and worries about the risk of COVID infection, and there is no known information on the psychological impacts of COVID among military professionals who are providing services. And when we come to the objectives, the general objective of this study was to assess the prevalence of depression, anxiety, and stress and its associated factors among midwives in Ethiopia. And those specific objectives to determine the prevalence of depression, anxiety, and stress among midwives in Ethiopia, and to identify factors associated with the depression, anxiety, and stress among midwives. And when you come to the methods, we have used a quantitative cross-sectional study design which was applied from May to end of August 2020, and the study is a nationwide study which includes midwives from almost all regions in the country, and the source population was all midwives currently providing clinical care in Ethiopia, and the study population was all those midwives currently providing clinical care in Ethiopia, and during the study period randomly selected as samples. And when we come to the inclusion criteria, all midwives providing clinical service were included. And when we come to the exclusion criteria, those midwives who do not provide clinical services were not just automatically not included. And the sample size was 1,691 samples, and simple random sampling technique was used. And here is the sample size calculation formula. We used the single population proportion formula to calculate the sample size, taking a previous proportion of depression which was conducted in China during the earliest times of the COVID outbreak, which was 20.1%, and we had used the margin of error of 2%, and we consider 10% response rate, which provides us 1,691 samples. And when we come to the sampling procedures, first of all, we have taken the very recent list of contacts of midwives from the Ethiopian Midwives Association Midwives database, which is the very recent and being updated in 2019. Almost there are 16,925 midwives in the country, and from the list of this amount of midwives, the total sample proportionally allocated to all the regions and city administrations in the country based on their number of midwives. And then using simple random sampling technique, we had selected 1,691 midwives from the database. And here are the variables. The depression, anxiety, and stress were the dependent variables, and the independent variables were those social demographic characteristics, knowledge towards COVID-19, attitude towards the COVID-19, and application of those preventive practices towards COVID-19 are considered as independent variables. And when we come to the measurement, we assess depression, anxiety, and stress using the DAS, depression, anxiety, and stress 2-in-1 scale item, and 7 criteria for each of the depression, anxiety, and stress questions. And here is the measurement that we used. We used depression for the scores 0 to 9, and for anxiety we used the scores 0 to 7, as well as for the stress we considered 0 to 14 scores as a normal findings, and all the other, the mild, the moderate, the severe, and extremely severe findings considered as having depression, anxiety, and stress. And when we come to the knowledge towards COVID, a midwife who scored the mean value and above among knowledge questions considered as having good knowledge towards COVID-19. And a midwife who scored mean value and above among attitude questions considered as having a favorable attitude toward this COVID-19. And the prevention practice towards COVID-19, those midwives who answered the mean score and above among COVID-19 preventive practice questions are considered as having good COVID preventive practice. And the data collection tools, data were collected through the telephone interview. After identifying the list and the contacts of those midwives, the data collected through a telephone interview, and 15 data collectors, especially for those regions who do not speak Amharic, multilingual healthcare professionals had been used, and two supervisors involved in supervising the data collection process. And pre-tested done among instructors in the University of Gondar, among military instructors in the University of Gondar, as well as training provided for data collectors and supervisors. And there is no any identifying information collected from those participants. And data processing and analysis, the data was entered into the Google Forms platform and analyzed using SPSS version 21 software. And frequencies and cross-tabulations were used to summarize descriptive statistics, as well as bivariate and multivariable logistic regression analysis applied, and variables with a p-value of less than 0.2 considered in multivariable analysis, and p-value of less than 0.05 with 95% confidence interval, and also used to determine and show the strengths of association. And ethical clearance was obtained from the IRB of the Waldia University, as well as support letter obtained from the Ethiopian Midwives Association, and informed consent was obtained from each of those participants. And regarding the results and discussion, when you see the social demographic characteristics of those study participants, a total of 1,498 midwives, which almost makes a response rate of 88.6%. And the median age of those participants was 27 years, and almost 52.1% of those participants were males, and almost 51.3% of those participants were married. And the mean work experience of participants was 5.72 years, and almost three-fifths of those midwives has less than 5 years of work experience. Here is the table showing the social demographic characteristics of those midwives. And here is the distribution of midwives working by working administrative region. And as you see in the figure, almost 25% of the participants were from Oromia, 23.7% of the participants were from Amhara, and 17% of the participants were the southern nations and nationalities region, which means the former SNNPR region. So that this, as its figure shows, almost only the regions and city administrations included in data collections, and midwives working there had been included. And COVID-related knowledge, attitude, and preventive practice. Almost 58.5, 39.4, and 57% of those midwives had good knowledge, attitude, and preventive practice towards COVID-19 respectively. And 80.4% of those midwives fear that they may probably get infected, and almost 92.5% of those midwives fear they may transmit COVID-19 to their family. And almost 92.1% were interested to give care for women with COVID-19, where we had already asked them whether they are interested to provide care for those women with COVID-19, and 92.1% were interested, and 42.7% had been in any crowded places in the past 2 weeks. They have been in markets, churches, and wedding ceremonies in the past 2 weeks prior to the survey. And COVID-19 related knowledge, attitude, and preventive practice. Among the participants, 61.5% responded that COVID-19 could be vertically transmitted to the fetus, as well as only 54.3% mentioned women with COVID can breastfeed her baby. And when it comes to the depression, anxiety, and stress among midwives, midwives reported mild to extremely severe forms of depression. 41.1% of those midwives reported to have depression, with the confidence interval of 30.6 to 43.7, and an anxiety of 29.6 with the indicated confidence interval, as well as 19% of those midwives developed stress with a confidence interval of 17 to 20.8. And here is the rate of depression, anxiety, and stress among those midwives. And when you see the severity of depression, anxiety, and stress, almost the mild, moderate, severe, and extremely severe forms of depression, anxiety, and stress have been shown. All right, when we come to the prevalence of depression, anxiety, and stress, the findings of this study is lower than studies conducted in Ethiopia, which was 60.3 of depression, anxiety 78%, and stress of 33.8%, as well as another study in Turkey, and from another study in China among healthcare workers. This difference could be the difference in data collection times. Those mentioned researches have been done on the earliest stage of the disease, and this may bring a certain change in the rate of depression, anxiety, and stress among midwives, but higher than a study in Singapore, that this difference could be a perceived exposure among healthcare providers, and due to the nature of their work practice, midwives cannot keep their physical distance, and which also require a prolonged contact with patients, so that it may increase their depression and anxiety, as well as stress towards the disease. And when you see the bivariate and multivariable logistic regression analysis for factors associated with depression, almost being female, as well as living in rural areas and working in government facilities, having poor knowledge of towards COVID-19, and having poor preventive practice, and using substances were found to be associated with developing depression. And when it comes to the anxiety, almost having working in government facility and having a poor preventive practice were associated with developing anxiety, and those midwives having residing in or working in rural areas, as well as those midwives who use substances and who have poor knowledge and attitude towards the disease were found to be more likely to develop stress among than their counterparts. And those midwives were 1.35 times more likely to develop depression as compared to with males. This finding is in line with studies done in China. This could be due to the cultural women are responsible to take care of the family and control household activities. And those midwives who are residing in rural facilities were more likely to develop depression as compared with midwives when working in urban areas. And this finding is supported by a study done in China. The possible reason might be the lockdown influence and access for information, as well as the personal protective equipment are limited in rural areas than urban areas. But this finding is contradict with the situation that isolation, quarantine, and treatment centers are located in urban areas, as well as midwives could get depressed in fear of the risk of acquiring infection, and these are contradicting ideas. And those of developing depression and stress among midwives with poor knowledge of COVID were found to be 1.4 and as well as 1.44 times higher compared to their counterparts. And the finding is in accordance with studies done in China. And those providers, this could be due to that the reason that those providers with good knowledge could better understand the situation than the disease, that the disease is so much contagious, and also could be liable to misinformation in searching for those new updates. And those midwives with poor COVID-19 preventive practice were 1.83 times, as well as 1.47 times and 1.6 times more likely to develop depression, anxiety, and stress, respectively, as compared to their counterparts. This could be due to the fact that respondents who practice preventive measures of COVID-19 are less likely to acquire the infection, taking care of and complying with the disease preventive strategies, which could give a sense of protection, which could reduce frustration and worry, so that they are less likely to develop stress, anxiety, and depressive symptoms. And also depression and anxiety were 1.6 times higher and 2.06 times higher to develop depression and stress, respectively. The finding is in agreement with another study done in China. This might be due to the triggering effect of substance, which impairs the decision making, as well as the judgment ability of workers, reducing application of preventive measures. And those of having depression were decreased by 69% among midwives working in government health facilities than midwives working in private health facility. This could be due to the better job security in government employees. However, those of developing anxiety were 2.44 times higher among midwives who are working in the government health facilities as compared with those who are working in private facilities. This could be due to maybe due to the critical shortage of the personal protective equipment in government facilities. And also those of anxiety among midwives with poor attitude towards COVID-19 had 1.31 times higher compared to those midwives who have good attitude. And this finding is supported by study done among nurses and healthcare providers. And this might be because of the people, those who are not confident that the disease could finally be not controlled, and higher perception of susceptibility and severity may feel more anxious. And finally, when you come to the limitation of this study, depression, anxiety, and stress criteria, as well as preventive practice reports, are collected using a form-based interview, as well as they are almost all they are self-reported, which could be prone to social desirability as well as recall bias. And we didn't find adequate studies to compare and contrast depression, anxiety, and stress during the COVID era, and which make our discussion a bit shallow. And in conclusion, findings of this study show high rates of depression, anxiety, and stress among midwives, and being female, as well as residing in rural areas, having poor knowledge and preventive practice, and exposed to substance were independently associated with depression symptoms. And working in governmental health facilities, having poor preventive practice and attitude were also significantly associated with anxiety. And midwives who reside in rural areas who use substances, as well as those who have poor knowledge and poor preventive practice towards COVID-19 were associated with developing stress. And finally, the findings of this study is highlighted the need to improve psychological well-being of midwives to increase maternal and neonatal health care, and addressing the knowledge and preventive practice gaps through information, training, and safety protocols on COVID-19, prevention-related precautions, as well as there is a critical need that midwives should comply with COVID-19 prevention recommendations, and adequate personal protective equipment should be supplied while providing services in the facility. And here are some of the sample references used. And we want to acknowledge Waldia University for supporting this study, as well as the Ethiopian Midwives Association for providing and identifying those candidates from its very recent list of midwives, as well as we want to acknowledge the study participants, our data collectors, and supervisors. Thank you so much.